Hello, class. Welcome. Again, I'm Dr. Tonya Hernandez. This is going to be Social Work 785, School Social Work Policies and Services. I wanted to go over week 2 of our class. So I wanted to talk to you guys a little bit today about what school social work actually is, compared to what I think a lot of people think school social work is. Working in those schools for the 2 decades that I worked in there, a lot of times teachers, administrators, schools, counselors, school psychs, not so much, but a lot of administrative staffs and teachers kind of think that what a school social worker does is quick, simple, easy. Remember, we are the connector between home, school, and community. So we're trying to figure out how can we get this child in what we call it an ecological system, where we use systems theory. So we're looking at the kid in a whole system, trying to figure out how does the school affect that child? How does the family affect the child? How does the teacher affect the child? How does the kids in his school affect the child? How do community resources affect them? But we're looking at it as a systemic model. And what social workers really use in order to do this is what is called a genogram. So what I'm going to do is I'm going to kind of walk you through over the next few minutes here a genogram that was developed with a fake family. This was actually developed by a movie that was called We Once Were Warriors. I'm going to depict this as a case study of what a lot of our students go through and what school social workers are doing when they're working with a family. A lot of what school social workers do has to be held in confidence, not because we don't want to share that information with teachers or with the educational system, administrators, school counselors, whomever, but because we have to be able to apply FERPA, which is what we're talking about when we're saying that we have to keep their education, separate, right? We have to decide what can we divulge to other people versus what can we not divulge to other people. And so we have to divulge what's educationally relevant. So as I go through this family, if you are not a social worker and you're an educator, your mind might be a little bit blown based on the sadness of the situation and kind of what's going on with this. But I think it's important for us to see what it is that our students may be doing just underneath the surface that the social worker might uncover, and then have to figure out, how do I work within that child on a strengths perspective? So what is the kid really good at? What are their strengths? How do we build on those? And how do we continue that within a systemic approach to where we're actually connecting homes, school, and community? So a genogram is what school social workers do to kind of map out a family. The way that it works is, as you look at this particular one here, you'll see that we have squares which represent men, circle here that represents women. So if there's an X on it, it means that that person has deceased. If you see lines like this, it means that they are married, and then these are their children that were from that marriage. Again, this right here would mean that there was a sibling to Bob and to Lori who was a female. She was the firstborn and she's deceased. And then Bob and Lori are still living. And then we have a younger male who is also deceased. The grandparents of this particular family are both deceased, and the same thing on both sides. This right here represents a generational line, which means that what we're going to be worried about is the generation that's kind of coming underneath this, which I'll talk about shortly. So again, this is the Cerno family, and this is their genogram. So our story starts off with Amy. She's 33, and Dawn, who's 34. Dawn had a brother who has since deceased. Amy is an only child. She doesn't have any other siblings that would be with her. If she did, they would depicted such as this. Oh, and I'm so sorry. This one right here, you see how this line goes underneath this? This is showing that this was a married couple and they've since deceased. And then this is showing where Bob kind of came from and where her marriage kind of came from. So, and where they're working with. Okay, so Amy and Dawn are who we're kind of working with and what's going on with them. So the first thing I'll tell you is that they were married in March 3rd of 2006. And they have a son named Claude, who is 17. They have another son named Gerald, who is 15. Now you notice that Gerald has a double box around his name. That's how social workers identify this person as the identified client. You'll notice as you go through the social work class that it's kind of hard sometimes for us to determine who is our client and who is not. Is the school the client? Is the teacher the client? Is the student the client? Or the parents the client? So this just kind of helps us to delineate this is actually who our client is, but in school social work, it's a little bit different in that, as you'll notice as I'm going on, all of the children in the family, including the parents, kind of become part of our system and who we're trying to work with, connecting homeschool and community. They also have a younger sister named Melissa. They have another younger sister named Joni, and then they have a younger brother named Donnie. Now, once we map out the family in this way, we make little notes next to the different names so that that way we can kind of tell the story if we needed to regarding this particular family. So in our notes, we want to make sure that we're writing notes that the family is okay, that we could share possibly with the school or with others, or if we're subpoenaed into court or something. But we also want to be very careful that it's just enough notes that it's going to trigger our memory of the events that have happened. That way, as a social work professional, I can maintain confidentiality for the student and for the family while still being able to provide what is educationally relevant to the school and different people at the school and what they kind of need to know. So in this case, we need to know that Amy is now 33. When she was married at the age of 18, her parents did not approve at all of her marriage to Don. She is identified herself as an alcoholic. She's been a homemaker. She really hasn't worked all of these years. She's got 5 children, so she's working in the home. She just hasn't worked outside of the home. She did drop out of high school when she became pregnant with Claude, so she didn't graduate. She dropped out the last part of her senior year, and she very much would like to leave her marriage right now to Don. Now, if we get information about Don, Don is also an alcoholic. He is currently unemployed. He was raised by a very abusive family. He has been abusive with domestic violence to his wife and to his family, and they have witnessed that. And he also dropped out of high school when Amy became pregnant, and the two of them kind of had this, shotgun type wedding that, again, Amy's parents were not at all happy with. You'll notice here that Amy's parents are deceased. She does have an uncle named Bob, an aunt named Lori. On Don's side of the family, everybody is deceased, including his younger brother. So Don has no family supports, which is why we kind of do it in this way, so that way we can see what family supports, what community supports, can we connect Amy to or Don to with the rest of the family. Moving on, Claude is a gang member. He's into drugs. He does have a drug addiction problem. He is not close at all with his father. The two of them battle horribly. He does have a special education of other health impairment, and he has been permanently expelled from school and is no longer attending schools. And thus, his full-time profession is as this gang member and what he's kind of doing from there, and I'll talk more about that. Next, we have Gerald, and Gerald, again, is our identified client. So in this particular case, I would be a high school social worker that has received this case. Gerald basically tried to steal some computers from school. They were checked out to him appropriately, and then he tried to claim that they were lost, but in fact he had them, and he tried to pawn them off at the local pawn shop. And of course, because they're tagged as being the property of the school district was made aware of this. So they're trying to decide what to do with him. He has had multiple arrests, and he does have an upcoming court date. He does have learning disorder and a poor attendance, is looking back at his records, which we'll talk about that as we talk about how we do screenings and that kind of stuff, looking back at his behavior, attendance, and grades to kind of see what's going on. He's just starting to kind of experiment with drugs and kind of with the gang with Claude, although Claude is trying really hard to kind of keep him out of it because he realizes this isn't the best way to work with things. He does have severe behavioral problems at school as well as at home. Now we have Joni. Joni is 8 years old, and Joni is, we're talking about Melissa. Melissa is 13 years old. She does have a recent suicide attempt, and she was basically raped by a family friend at the age of 12. And I'll get more into that in just a moment as we talk more about this. So when we are, let me go on. So we also have Joni, who is 8 years old. She's a C student without very much effort. She's kind of a wallflower in her school. She does have kind of poor social skills. She doesn't really get along well with other kids, has difficulty making friends. She has been bullied at school, and the teacher is kind of suspecting ADHD. But as the social worker, I'm kind of suspecting maybe some trauma that might have happened, maybe some PTSD type stuff, or maybe depression or anxiety, something like that might be going on with Joni. And then last we have little Donnie. Now, Donnie has a delayed speech, and he does have asthma. He was born during the pandemic, during COVID times when all of this kind of came to like a big head. And so he's been around now for 3 years. He's 3 years old. So let me tell you a little bit more about the background story now that you have just what you would see if you were to grab a hold of this particular genogram out of my file. This is all that you would be able to read about this family. So good information, but not a lot of information without having to ask me, so that way I can tell you more about it. So what happened is Amy actually comes from a very affluent family, and she met up with Don, who has always kind of been a troublemaker, just kind of like a bad boy at school, really rebelling against her parents. She had adequate means, came from a lot of white privilege, should have had absolutely no problem going on to college and doing other things. She was a good student until she met Don, and things just really went awry. So Dawn's parents just wanted nothing to do with her and really had nothing to do with her children or anything to do within their grandchildren's life after she married Don. They tried a couple times, but just didn't like Don. And then the two of them passed away suddenly in a car accident. So she lost them kind of both at the same time. She does have her Uncle Bob and her Uncle Lori, which since her parents' passing, they've kind of reconnected. And they have, some say inside of Amy's life, but when her parents passed away with their monies, they did not give any of that to Amy. So she was cut off completely. Now, Don and Amy have a domestic violence kind of situation that happens, especially when he starts drinking. And their house is kind of known as the party house in the community. So they like to have really big barbecues. They like to have really big parties. Don is a mechanic. And he made pretty good money with that. Even though he was an alcoholic, he was a working alcoholic. So he never missed work and was always kind of there. But it got really bad, like on the weekends when the parties and things like that kind of worked out. Now, what happened was Don never kind of grew up. And so Claude was kind of forced up here into the parental role. And Amy really used him as a crutch for helping with the other children and kind of raising the other children and being the father within the home. This created this issue between Don and Claude because Claude feels like, if I'm the one that has to kind of, help pay the bills and I'm the one that has to go out and do the grocery shopping and all these type of things, then I'm more of the man of the house. And so Don has no problems putting hands on Claude and vice versa, which is some of the reasons of what has kind of happened with him to turn towards the gangs, and his drug use was to kind of numb himself with this situation. Now, Gerald is a severe behavioral problem inside of the school. And a lot of times when you have children who have that severe behavioral issues inside of a school, they are really they have like a big heart, and they kind of wear their heart on their sleeve, but they don't want other people to know that because in their childhood, in their family, they have to be tough, but they're willing to sacrifice themselves and their behavior in order to kind of draw attention to the family to say, hello, red alert, we kind of need help here, which is really what Gerald was doing. Excuse me. Sorry about that. I have a tickle in my throat. So it really is what Gerald is kind of doing, which is why he kind of took the computers and tried to pawn them off. Now, what kind of triggered all of this information is that Melissa was 12 years old, and there was a big party that was kind of going on at the house. It was like a July 4th party. And Dawn's friends from high school were still kind of there and were causing like a lot of different issues and things that were kind of going on. So okay, sorry about that. I had to pause for just a second. So anyway, there was this big July 4th party, and Dawn always has a lot of people around when they party, lots of alcohol that is kind of around there. And people normally would just kind of pass out at the house. So it wasn't unusual for people to be, just sleeping in the hallways, sleeping on the couch in the living room, just sleeping wherever. Melissa got up in the middle of the night and was thirsty. So she came downstairs, and of course she's dressed in her pajamas, which in this case was just a t-shirt in her underwear. She came down. She's just beginning to really develop puberty-wise. And unfortunately, one of Dawn's best friends, who she considered an uncle, saw her and took advantage of the situation and ended up raping her. Very sad situation there. She didn't report it or didn't say anything with it, but started really having more and more issues. And then the attempted suicide happened, which kind of triggered all of this information from happening. So when Gerald found out kind of what happened, these two are like really close. When it got up to mom decided that, you know what, I can't do this anymore. Don took the defense of his friend and not of his daughter. And so it was kind of the last straw for Amy. And Amy was like, you know what, my daughter's been raped. She just attempted suicide and you need to get the heck out. Like, if your friends are still going to be around here, I can't have that. I have to protect my children, and kind of threw Don out. Don became unemployed because the one of the people that he worked with is the person who actually raped Melissa, and they ended up kind of getting into a fight after Amy threw him out at the workplace, and the boss was there and saw it, and so he ended up losing his job because of that. And then, like I said, we have Joni and Donnie, which haven't totally been affected by this, but they have been. Joni is looking like she has, again, maybe some PTSD type stuff from all of the domestic abuse and domestic violence that she's seen inside the home, the party and things like that, her sister committing suicide or trying to commit suicide, and then, you know, Donnie having his delay of speech and his asthma could be a, you know, developmental delay that's kind of happening. So what happens is, once we know all of the stories for the family, as a social worker, we kind of take and we draw a line around who within the family are we now identifying as our client. And in this particular case, these are the people that we're identifying. Don is not identified in this because he's currently not in the home. He's outside of the home and he really doesn't want our services, excuse me. So we were talking mostly with Amy. She was kind of providing us the services as to what we're doing. So as we start to develop the Ecomap, which has to do with our systems theory for this particular family, we're looking at Amy, Claude, Gerald, Melissa, Joni, and so here, I forgot to tell you about this part. So Donnie is named after Don, and when mom threw him out, she decided to go by his middle name, which is Nicholas, and so they now call him Little Nicky because mom doesn't want anything of Don inside of the house or her children to identify with him or talk to him in any way, because she is so upset with what happened with Melissa, which is why on this slide here, you'll see him as Little Nicky, because this is how they refer to him, but this is the same child. Part of what we want to make sure that we're doing is being respectful of our client's culture and their requests. And so Donald Nicholas is his name, and so now he goes by Little Nicky. So as we're looking at this, we start trying to figure out, okay, what services do we need to do to kind of wrap around this family to help them to start kind of being a little bit more stable? So the first things that we need to look at is obviously the school, right, is looking at the fact that Gerald tried to steal these computers and pawn them. They're maybe looking a little bit at Joni. Melissa's kind of flying under the radar at her school. No one's really paying close attention to her. The school is unaware of the suicidal ideation or the attempt. Joni has kind of flown underneath the radar. Her teachers may be a little bit more concerned about it, but most of the information we got was from mom. So mom says, you know, Joni is just kind of there, and Little Nicky is just kind of not feral, but close to like what he's doing because of all the stress that's kind of happening around. So we have to figure out, how do we stabilize this entire family? The last thing we want to do is have them thrown out on the street, or, you know, have them to not have insurance, because when Don lost his job, the family lost insurance. Mom's never worked outside the home. And so, you know, she doesn't really have any kind of skills. She's, again, dropped out of high school. So there's a lot to kind of do with right now with this particular family. So the first thing we want to do is go to our three big kind of areas to make sure that we're working with this family. So the Neighborhood Family Service Center is a service center that can provide services to the family free of charge, such as counseling services or mental health services, which this family definitely needs. And so we might refer them over to the Neighborhood Family Service Center. There's also some other, you know, different types of things that they might be able to do with them. To try to help with the housing situation, we're going to refer to the Clark County Housing Authority and try to see if there's any housing assistance or anything that we can do to kind of stabilize the family so that they're not having to be uprooted or become homeless, because Amy just sent Don out, and then Don immediately lost his job once she did that, and has now just been in an alcoholic stupor ever since, and hasn't really helped much with the family. We would also send them to the state welfare. So the reason why we would make this particular referral is because mom might be able to get Medicaid for the family, so that way they do have insurance. She might be able to get temporary assistance for needy families, or what they call TANF. She might be able to get, sometimes they have like special grants and things that they might be able to give to Amy as she talks to them. So if she wants to be retrained into something, they might be able to help her with that. Or if her car is broken down and she really needs the car to be able to get to job interviews now, they might, be able to help with that. So there's different types of things that they can do. And it would really kind of depend on Amy and what she's wanting for her family, because we always start where the client is. So we have to kind of start where Amy's head is at. And then Clark County Social Services, which would again kind of help with different food banks and payment for rent, payment for utilities, payment for those type of things, while we're trying to get things kind of stabilized for the family. The next thing that we would want to do is we want to liaison with our school team. So it's important as we go through this class that you kind of think about who is the school team in this particular case, and what school are we liaisoning with. I have another slide where I talk about collaborating with other school social workers in other schools, or the school counselors, which is kind of what we would be doing, especially if I'm assigned to Gerald's high school. Then these three aren't even at my same school. And so how do I work together? But I do want to how do I work together as a team with them? But I do want to make sure that my school team at the high school is kind of aware of what's going on and what we're working on with Gerald. So, the principal needs to kind of look at this and decide, okay, is this, restorative justice kind of a thing? Is this progressive discipline that we want to work on with Gerald? He pawned these computers because he was trying to get the money to buy food for his family. So when you know that, does that kind of change your thinking about Gerald and why he kind of did what he did? And as soon as mom found out what it was, they returned the money, got the computers back. And so the computers were refunded back to the school. So this is where the choice behavior versus skills deficit kind of comes in. So is this a punishable offense that Gerald should have or not? That would be something that you would have to talk with administration about and kind of see where their stance is on it, and then help the family to, move forward with whatever decision it is that they kind of had. Your school team could include your school counselor. It might include your school teachers. It might include school psychologists. It kind of depends on where you're at with that. And then what are you going to tell them as a social worker? Teachers do not need to know that horrific story. They don't even know Melissa, his sister. So would we have to tell them that this is what's going on? I personally would not. I would tell the teachers that Gerald is having a lot of hard times right now in his family. I would ask Amy if it's okay if I shared with the school that her and Don have recently separated, without providing any of the details with that, and that Gerald, is kind of worried about some of the things that are happening there, and that's probably causing some of the issues that he's having. So I would talk with mom beforehand and make sure that she is completely aware of what it is that I'm going to share with the school, and that she is actually okay with that. And then I would share that much and that much only. I want to make sure that teachers are understanding what Gerald is going through, so that their empathy can come out and they can kind of help him with that and support him in those ways, let him know that he is wanted and needed at the school. But I don't want to provide enough information that I'm freaking the teachers out, or that teachers start, rumoring about him and the family and like what's going on. So you'd liaison with the school team. Next, we would refer them to Safe Nest. So we would go ahead and refer him on over to Safe Nest. And what I would say with Safe Nest is, because of this domestic violence situation that Amy has with Dawn, and the fact that Dawn is drinking quite a bit, and that's usually when he is the most abusive, and she has thrown him out of the house. So that is the most dangerous time for a woman to leave a man, is that's when they're in the most danger, is when she decides she's leaving the relationship and is ending everything, especially a domestic violence relationship. And so I would make sure that I referred over to Safe Nest, so that way, if she doesn't want to go into Safe Nest, because they could provide housing and shelter for her and her children because of this domestic violence situation and what happened. So again, this could be one way if they're going to get thrown out right away, which is why I have the housing authority and Safe Nest so close together. But you now want to make sure as a social worker, when you're doing this, that you can defend your referrals, that I'm not just saying, oh, I want to send a safe nest just because. I want to have a good reason as to why. Each of these things would kind of come along as we're kind of moving and saying, okay, here's where we're headed to first. We work with mom to get these referrals done. Then we work with mom for the next set and the next set and so forth. So this case could actually last for years, right? For the social worker to actually go through everything it is that mom is needing and to help her become more stabilized and to help stabilize the family. This isn't just a real quick send a referral and I'm done with them. This is going to probably be a case management thing that's going to last for quite some time. But Safe Nest, again, might be a good place for us to start to help get the family into good shelter where we know they're safe and we know that Dawn can't find them or hurt them in any way. And that's going to be up to mom. FACT is the Family and Child Treatment Center. This is where Melissa would get referred to because of the sexual assault that she had. It had not been reported, and so we helped mom to go ahead and report that. And then FACT is one of the things that she can get for free for her services to help her to overcome the trauma of the rape that she has had. We would send mom to adult mental health. Claude is very close to being 18, and so therefore he could potentially go to adult mental health as well. Mom has some issues with depression. She's got issues with alcoholism, and obviously all of the stress and everything that's going on. Claude is the same way because, again, he's tried to be the parent in this whole thing, but it's kind of got this, bad boy again, look about him and things that he was doing as he's trying to help his family. West Care is a drug abuse center that we could send Gerald to and potentially Claude to if they wanted to help them with their drug addiction and their substance use. They do have inpatient and outpatient care, so that could be we can't really help with any of the other mental health issues that Gerald or Claude are having until we work with the substance abuse issues that are going on. So as we're liaisoning with our school team, we might be developing a plan of care or a behavioral intervention plan of how can the school best support Gerald in this time. But before any type of other mental health services can occur, we really need to get him off of drugs and, kind of stabilized in that way. So then that way we can look at some of the other issues that are kind of causing the drug addiction. So there's kind of a hierarchy of how we want to go about doing things. We also have Communities and Schools has a medical clinic that we could potentially go to. So we would look at communities and schools and try to see, if we could have some different supports or different resources, different things that maybe they might be able to do. Some schools have those on campus, some do not. Nevada Legal Center services at UNLV or the Advocacy Center for Amy because she would like a divorce and restraining order and that kind of stuff that's happening. Also because Gerald is, is going to be going into court because of some of the things that he's done. So, they might need some additional help with that, and Claude as well. So they want to make sure that they're covering all that bases. We might go to Big Brothers and Big Sisters to kind of give mom a little bit of respite. If we can find a good big brother or big sister for little Nikki, Joni, or Melissa, even Gerald, if Gerald is willing to do that. Real Talk and the Coroner's Program are two really good programs that we could send Gerald to and potentially Claude to, and it really just kind of helps them to understand the choices that they're making and the long-term consequences of those particular choices. We would really want to collaborate with the probation officer that Gerald has and maybe even who Claude has, just so that way the probation officer knows what's kind of happening at the school. Gerald knows that we're really working in collaboration with the PO. Mom knows that as well. It gives her like a little bit more support, especially without having dad there in the picture with two adolescent males who, are now going to be testing boundaries and things like that. So collaborating with the probation officer is always a good idea for us to do. And then we're going to collaborate with the other school teams. So Melissa, Joni, and little Nikki are all going to different areas. Melissa is in a junior high, Joni is at an elementary school, and little Nikki isn't in school at all. So what we would do is we would get permission from mom to go ahead and contact the social worker at Melissa's school. If there's no social worker there, we would look for the school counselor and kind of let them know what's going on with Melissa, making sure that they kind of know, what to be aware of and make that introduction between mom and that person at the school. Same thing with Joni. We would make sure that they're kind of aware of what's going on with her because right now she's, very inattentive and just, kind of this wallflower, not getting along very well with her siblings. So we could be able to do some preventative type of solutions in order to help her to kind of know what's going on and so forth with her. What we would do then is we would establish ourselves between them as kind of the lead in the case. So any referrals and that kind of stuff, we would want to make sure that we're part of a team with these other two social workers or school counselors. So that way mom's not inundated by all of these different schools kind of calling and saying, what's going on, but they could come through, the one person that she's kind of got this good relationship with and trusting now and working with. And then we would work with the other professionals at those schools to make sure that all that's happening. So for little Dicky, we would want to make sure that we refer him over to Child Find. So he is 3 years old, and we do suspect some developmental delays. He does have asthma. He is delayed in his speech. He was a COVID baby, so he born during COVID time. So there could be some social emotional issues or developmental delays that are going on. So we would make sure that we refer him over to Child Find and see whether or not he would qualify for those services, so we can start some preventative services for him as well. And then we would also look at like any anti-bullying issues that might be kind of going on. Joni is suffering for some bullying there at her school. So we would make sure that the professionals there at that school are aware of the bullying that Joni is experiencing, and then help them to kind of come up with a plan, or ask them to come up with a plan at their school to help support Joni with the bullying issues that she's having. And then last but not least, we would want to make sure that we are attending any and all IEP and MDT meetings. So individual education plans or multidisciplinary team meetings, or any type of meetings that they're having at the school that would be like, your liaison with your team members. So if you're having a multi-tiered systems of support meeting or response to intervention meeting, anything like that, we want to make sure that we are collaborating and working with the school and kind of going with everything that's going on with that. So this right here is going to conclude this part of the PowerPoint that I wanted you guys to learn about, the Ecomap and the genogram that we would kind of do, and the complexities that some of the many of the cases that we have for school social workers actually kind of comes up with, just so that you're kind of aware of that. So I thank you guys, and you have a great evening.